Well, thank you all for joining us this evening. And I want to first start by acknowledging, I'll of course, let my colleagues say some words as we move forward, but I want to thank you to our Zoom vaccine town hall. Obviously, if we were not in COVID, we would be doing this meeting somewhere across the borough, and we probably have hundreds of people in attendance, but safety first. So let me just briefly thank my colleagues who are here, Councilmember Karen Koslowitz, Councilmember Holden, Councilmember Adams. I believe Councilmember Van Bramer will join us. I see my Assembly member Khalil Anderson is on, and then y'all will alert me as more electeds hop on as well. And we'll of course acknowledge them as well. Let me just first start off by thanking DOHMH for taking the time to educate our communities and have an open forum on the COVID-19 vaccine. A special thanks goes to Dr. Easterling, who unfortunately will not join us tonight. And I want to start by acknowledging and wishing our health commissioner, who I was actually texting with a little while ago, a full recovery. I'm wishing him and his family a full recovery during this difficult time for them. But I know they're doing okay. And we need to make sure that we support, our commissioner through this time as well, so he can get back on his feet and his family can be safe. So want to just acknowledge them. As we know, Queens was the epicenter of the COVID-19 pandemic. I don't have to tell you about how many friends and family members we lost, especially in Southeast Queens and Elmhurst, Corona, but all over Queens. Just a difficult time for so many of our families and friends. And of course, this is why we're here tonight. And I just want to stress, we're starting to see a fluctuation in the numbers of COVID cases. So I know Flushing, I believe, is leading Queens right now. And then we also have Richmond Hill, where we saw double digits, but thanks to the work of, many of my colleagues, Adrian Adams, Assembly member Khalil Anderson, we were actually able to get some testing ramped up there. And I believe that Richmond Hill also will have a vaccination site now. And one of the things we've been stressing during this period to both administrations is the importance of ensuring that we don't have to travel, a mile out of our communities to access these services. I can not stress enough also tonight that all Queens residents and families must follow the city's core 4 actions. And I know Dr. Ray will talk about that. Stay at home if you're sick, wear a mask, practice good hygiene and wash your hands, stay at a social distance from others outside of your home by staying at least 6 feet apart. I'll just run through some quick things we've been up to in the office, and I want to thank my staff. To date, our office has distributed roughly over 30,000 masks, thanks to the mayor's office, governor's office, and additional donations, along with personal protective equipment, PPE, and hand sanitizer. Also remember, once again, to the public, to get tested and schedule an appointment to get vaccinated if you are in the particular phases where you can and you're eligible. Testing is a key component in the battle against COVID-19. It is important that all New Yorkers have easy access and the ability to get tested. And I would continue to stress that to communities who, unfortunately still are scared of getting tested, and individuals. I get tested often, my staff gets tested often. It's painless, it's quick, very efficient with the Health and Hospitals Corporation. They've done some great work. They have an app. You get your results back in a timely fashion, at least I found. So please get tested. And I know that more people are, and that's been certainly encouraging during this time. Just some other things lastly, just where we're headed. And once again, it's been good to hear the mayor starting to hear the mayor talk about ensuring that there are more vaccination sites in underserved communities and communities of color that historically, when we look back early on in the pandemic, who did not even have access to testing. So that's been a welcome addition so far. And also, I will also add, we're working on our airports as well. So I know LaGuardia Airport has offered testing. We're working on JFK at this moment as well. And we look forward to that continued conversation tonight as well. So I'm going to go to my colleagues, but I just want to stress to everyone watching tonight, We are doing this because we want you to know that this vaccine is safe, and it's important. It is critical in order for us to get back to some semblance of normalcy as we move forward. And we know that in communities of color specifically, that we've had a history with experimentation in this country. When you think about the Tuskegee experiment, you know, this history never leaves us, and we know that. But we want you to know this is not experimentation. This is about making sure that you're safe, that your families are safe, that your friends are safe, that your community is safe. And I know we're going to lead from the front. when the vaccine is available to us, we will certainly be taking, I will be taking it as well. So you'll witness me get a shot in the arm. So with that being said, I want to go to my colleagues just to give some brief remarks, and then we're going to go to Dr. Ray. And I want to thank her for being here. She is the Health Equity Data Lead at the Department of Health and Mental Hygiene, and very important as we talk about equity and access to this vaccine. Very critical to have her on tonight. So I want to thank you. I'm going to go to first my delegation chair, Queen's Delegation Chair, Karen Kosowitz, to say some words. Unmute yourself, Karen. There you go.
Thank you so much, Borough President Donovan. I have to say that I was lucky. I got an appointment. I had my first vaccine in January, and I'm going to have my second dose this coming Wednesday. So I'm lucky, but the people in my district, many of them have a hard time getting the vaccine because the closest place that they could go is Hillcrest High School, which is not that close. For a senior to go to Hillcrest is not an easy thing. I was just notified by the Forest Hills Tennis Stadium that they're willing to open up and give vaccines. So if we could do something about that, that would be wonderful. But I want to thank you so much for taking the active role that you have taken in this COVID time in our lives. And hopefully everyone will get vaccinated and we'll be able to go back to normal life. Thank you.
Thank you, Karen. We're going to go to we used to be the dream team. I don't know if I'm still allowed to be in it now that I've left the council. But we have our co-chair of the Black and Latino Asian Caucus, Councilmember Adrian Adams, who's done a phenomenal job in the council in pushing for equity, not only in testing, but for the vaccination as well. And, you know, I always say our team's success is everybody's success. So thank you so much, Adrian, for being here.
Thank you, Donovan. So very honored to call you my borough president. You're doing an amazing job, which we knew that you would.
Right.
So it's to be here with you, my colleagues. And my colleagues in government. It's wonderful to be here with you. I just side note, Khalil, you look great in a bow tie. You know, last week, my little brother, and you look good. That bow, do that. Keep on doing that. You wear it.
And I'll try to mix it up a little bit.
You wear it well. You wear it well.
Thank you.
I just wanted to say, you know, Dr. Ray, Missouri Ray, thank you for being here. Your work is exemplary. You know, for those of us in Southeast Queens, it's been a long, hard fight since the beginning of this pandemic. We have been living this thing personally, professionally, and every which way to Sunday for us since about March, almost a year now. We've been living this. We have watched our constituents die. We have watched family members die. Personally, I lost my dad, which you all know, I believe, due to complications of COVID. He was actually COVID positive when he passed. But, you know, that said, to those who may be apprehensive, I think I don't say this enough, and I'm just going to say this, to those who may be apprehensive because of the history that we share as Black people in America and looking at the Tuskegee experiment. Remember, the Tuskegee experiment was around people that had syphilis who were given a placebo. This is totally the antithesis of that experiment. So if we don't know anything else, please know that this vaccine is meant to cure you and keep you from getting sick, not the opposite. So we're talking apples and oranges, even though we are talking an ugly history as far as healthcare and health concerns for Black and Brown people in this country. We understand that, but we want you to live. We want to live. If I were eligible, I would take this vaccine tomorrow. I wish it were available when my dad was still here. So let's just find out, the real deal on this vaccine, and let's get ready to roll up our sleeve and save our lives. For those that are looking for sites, for vaccine sites, please know that your elected officials have been fighting to get you vaccine sites since day one. We know it's frustrating, it's difficult, but we have been in the background, in the front ground, in the side ground, fighting for you to get you vaccinated. This is what we want. So the fight really is for us to continue to undertake as those who have the mayor's ear, whether we're listened to or not. We will continue to bang on his front door and continue to let him know that he needs to reprioritize, reassess the distribution of this vaccine that all New Yorkers so desperately need. So with that, I'm not going to talk any further. Thank you again, Borough President Richards, for having this forum. We can't have enough of these. Thank you so much. And everybody that's participating, I thank you very much. Thank you.
Thank you. Thank you, Adrian. I'm going to now go to State Senator Leroy Comrie, who's done a lot of great work around this as well.
Thank you, Borough President Richards. I appreciate you allowing me to come on to this Zoom as well and to try to let people know that this is something that we need to make sure is that that everyone understands and appreciates so that they can take it. And as Councilmember Adams has so well put it, she always lays it out properly and distinctly. We have been fighting to get more sites open throughout the community and get the governor and the mayor's office to approve more sites, and we are all working collaboratively on that. This forum today is to just try to make sure that people are ready and willing to take the vaccine. One of the things that have been happening is that even at the sites where the vaccine is available, in certain communities, people are afraid of the vaccine because of boogeyman conversations that are not based in reality. Conversations that don't understand that the people that developed the vaccine were minorities. It was a Black people on both the Moderna team and the Pfizer team that had a major role in developing these vaccines. There were minorities on both teams that were part of making sure that the efficacy rate was done and that they would be handled in a proper manner throughout the system. So there are people that are ensuring now that the vaccine is, and people that have been testing, people that were tested on this vaccine and people that we know that have taken the shot. Our congressman has taken the shot. He's still walking straight and talking straight. In fact, he's been more active than ever before. So Karen Kozlov has shared that she's taking the shot. She's smiling and looking happy, and she's ready to re-engage people. I know, other people that have taken the shot, and that they have, the first phase of the vaccine, and my from every report that I've heard from them is that they're all healthy and they're all functioning well. So, this vaccine is something that we need to make sure we can all embrace and take. As soon as I'm eligible to take it, I'm going to take it as well, and I want to encourage folks because I want to be able to see. I haven't been to your office because of the vaccine. I want to see the new borough president in his office. I want to see
Just wear a
Karen
mask. You always
Kozlowitz again. I want to see Jimmy Van Bramer with this gray hair that I'm seeing on his chin. What is this, Jimmy? And Bob Holden as well. I haven't seen him or anybody in a minute. So, well, Bob, you and I are getting gray together, so it's all good. So, but I want to see people again, and I don't want to just walk by Kareem, Assemblymember Kareem, in the hall and can't really say hug him because we saw each other at the LOB last week. We had to go like this, hi, how you doing? That's not the way I work. That's not the way we are. We want to be able to see people again. And in order to do that, we need to dispel any fears. And I really want to thank Dr. Didi for being here and breaking it down in the science. I want to encourage folks that, through the borough president's office or through any of us, to do as many workshops and outreach as possible so that we can dispel all these boogeyman myths. The good thing of the internet is that we can reach people virtually. The bad thing with the internet is that a lot of foolishness can get put on there and all of a sudden be thought of as real. So I'm glad that we can have these forums. I want to thank you, Borough President Donovan Richards, for making sure that this forum is held and that we can do many more until we get right through to the heart of the community, that this vaccine is safe and that everybody should take it, so we can get back to life as New Yorkers, where we're bumping into each other and talking to each other, and they're looking at each other face to face, so we can share our passions and concerns about what we want to see in this city. So thank you for hosting this, and I look forward to the Q&A from the public. Thank you.
Thank you. We'll now go to Councilmember Van Bramer.
Thank you very much, Borough President. And Senator Comrie, I just want to say, I'm not sure who went gray first, but we both wear it well.
I've been great for the last 10 years. It's just being more pronounced at the moment.
I think I have you beat. I've been great for 20, but I just want to say, look, we all come from different parts of the borough. Sometimes we disagree on issues, but tonight we are all on the same team. And that is to make sure that every single person in Queens, no matter what zip code they happen to reside in, has equal access to this vaccine. We know that isn't the case right now. We know that far too many people who are eligible, including my 81-year-old mother, are still not able to access the vaccine. And it is sadly true that Black and Brown communities disproportionately don't have access. And I want to mention and lift up our public housing communities, of course, in Western Queens, in my area, Queensbridge, Ravenswood, Astoria, and Woodside houses. We need to make sure that there is the vaccine being brought to our public housing developments. We do have pop-up sites at Ravenswood this weekend, but we need to do so much more. We also need to recognize zip codes that are particularly affected. Woodside, for example, 11377 is the highest level of positivity in my district, in our area, and there just aren't enough vaccination sites. That's a federal issue, that's a state issue, that's a city issue, but we all need to come together as one borough to fight to make sure that more vaccine is coming to Queens and getting into the arms of our most vulnerable members of each community. So I'm glad to be here with the borough president and all of my colleagues, and most importantly, the people of Queens, to make sure that we're speaking with one very clear, united voice that we need the vaccine, we need it done equitably, and we need folks to believe that when your time is up to be called and you're eligible, to please get vaccinated so that we can all return to life and we can save lives. And then all of us can be back there to celebrate Senator Comrie's gray hair and Councilmember Holden's gray hair and my gray hair all together. And with that, it is my fervent wish that everyone stay safe in this very, very difficult time. Thank you.
Thank you, Councilmember Van Bramer. We now will go to Assemblymember Khalil Anderson.
Yeah, thank you so much, BP Richards, for having the foresight to get us all together as electeds and leading on this very important issue. I hear that having gray hair is a sign of wisdom. So you guys should be happy about the gray hair, Senator Comrie and Jimmy.
You have a lot of time.
Me and Donovan and Adrian, we're still working.
I got some, so don't even say it.
I got some. But yeah, thank you to my colleagues for working hard on this issue. You know, I know that I've been and my team, my staff, we've been working really hard with Councilwoman Adams and other folks and Senator Sanders and with, of course, BP Richards on addressing the issue of vaccine equity, but also making sure that folks have the tools and resources that they need to best protect themselves. So distributing hand sanitizer, distributing masks, and reinforcing the importance of getting tested, but also remaining socially distanced and avoiding large gatherings. That's important. Just because the vaccine is out doesn't mean that we go to sleep and we forget the importance of maintaining those very four key and important traits. You know, the sad reality is that every day we're losing upwards of 24 people here in the borough of Queens. And we frequently, according to the governor's numbers, we frequently rank the highest county in the state as it relates to COVID-19 related deaths. And I believe that we can get that down by continuing to push the word, push the message of making sure that folks follow those four key traits, but also making sure that vaccine equity is a real thing here in Queens. And as we're talking, Johnson & Johnson just applied for an emergency authorization to get their vaccine out. And I know some of the folks were concerned about the vaccination, have to go and get 2 doses. And I know Johnson & Johnson has a vaccine that's only 1 dose. So this is something that folks are concerned with, and things are changing rapidly. And we want to make sure that these things are in front of you as well. I know South Richmond Hill and South Ozone Park, where me and Adrian share, has been up in COVID-19 cases. And we have to keep our foot on the gas pedal and ensure the importance of getting tested and following those key 4 traits. Let me just give some updates on what the Assembly's done this week. We passed a municipal death benefit to make sure that people who work for the municipal government who have lost folks to COVID-19 can get a death benefit for their family members. And we also passed a bill just yesterday or the day before that allows folks to have time off to go get the vaccination. We know a lot of working class Black and brown families will get an appointment, God willing, with the system being as anyway. Folks need the time off to go and get a vaccination, and that's why we passed that very critical piece of legislation this week to really allow folks to be able to have that opportunity to take off, get their vaccine, worry-free, paid, not have to lose any hours. It's very important. And our office is going to be holding testing in the South Ozone Park section of the district in the next couple of days, making sure that we get the word out and also working with Test and Trace to make sure that folks are getting tested in South Richmond Hill and South Ozone Park. So again, thank you, Borough President Richards. Thank you to all my colleagues who have been working tirelessly to make sure that we promote vaccine equity, get you all to trust and believe that this vaccine will help us address this COVID-19 crisis. And thank you for doing your part, folks all across Queens, keeping socially distancing, testing yourselves regularly, and making sure that we practice social distancing, but also use hand sanitizer and masks where appropriate. So thank you so much, BP.
Thank you, Assembly Member. And now we'll go to Councilmember Bob Holden.
Well, thank you, Borough President Richards, and thank you for doing this. And this is one of the most important events that we can attend. But I just want to mention to Senator Comrie, I miss you too, and I like the gray hair. You look very distinguished. So I would keep it. I would keep the gray hair. Don't go to the Grecian.
No, I'm not. Too many people see me every day for me to start using dye.
You don't want to do that. You don't want to. Yeah. So. And Jimmy Van Buren didn't do it either. So everybody does look distinguished with gray hair, except me. I'm losing it. So I need to hold on to as much as I can. But anyway, I want to thank Borough President Richards. Certainly looks good in that chair. Nothing is more important than a swift and efficient vaccine rollout. And, I'm doing the COVID testing in my office. I did it today. We were snowed out on Monday, unfortunately, but we're going to do 2 next week. And I followed Councilmember Ulrich's lead. He did testing in his office, and I think he's going to do some more. Because I don't have COVID testing in my district. I don't have vaccine locations in my district. So that is a problem. I have a very large senior population. And as we know, seniors need the vaccine desperately. There are so many heartbreaking stories that families are in my district and everywhere are telling us and it really is the biggest. I would say the biggest problem with not only the COVID, but when your loved one comes down with COVID, you can't visit them. You can't see them if they're in the hospital. You can't see them in a nursing home. And unfortunately, my 96-year-old mom was in a nursing home, and got the COVID a couple of weeks ago. And, in a serious, she's in the hospital. And it's been now 2 weeks and she can't shake it. And she's on oxygen. But the most heartbreaking, like I said, is I can't see her. I can't be with her. I can't hold her hand. I can't talk to her. I can talk to her on FaceTime, and it's a little difficult for her, but it's just so heartbreaking. And so many families have told me about that, and I'm going through it now. Not seeing my mom for almost a year is torture. But I'm encouraged that we're seeing the light at the end of the tunnel. I'm praying for my mom. And I just would love to just hold her hand, just say, we're with you. We're still here for you, but I can't even do that. But, and again, that's the biggest problem we're facing. And hopefully the vaccine is the answer, and I'm sure it will be. The problem is the rollout. So my colleagues in the city council, and I thank them, they all signed, 30 of them signed on to my letter to the mayor asking that senior centers get involved in the vaccine rollout. And there's a lot of win-win on that, just that many seniors would be exposed to a senior center, obviously, and many seniors know the senior center, and they're close, many are close to their homes. And we're also paying for, many of us in the council are paying for free transportation to the vaccine. So it's very, very important that we get this right. We do it swiftly. I'm encouraged, like I said, about the CVS rollout. That makes sense. But I think also we need to make the process easier for our seniors first, because they are the most susceptible, more than any population, more susceptible to the COVID, and certainly are passing away from the COVID at a higher rate. So I think we need to fix the Health and Hospitals website at nyc.gov so it is user friendly and finds you a vaccine, as quickly as possible. So there's some encouraging news, like Johnson & Johnson, the Assembly member just mentioned, but I think we need more information too to get more people to want the vaccine. I'm seeing, a lot of people saying, I'm not getting it, and that's a mistake. You should get it. It gives you extra protection. And it's, like I said, especially seniors who have a weakened immune system and they need all the help they can get. And the vaccine is a godsend. But again, rolling it out is the most important thing. So thanks, Borough President. Thank you to all my colleagues. And let's encourage everybody to get the vaccine as quickly as possible.
Great, thank you. I saw Assemblymember Hyman a second ago. I guess she might have hopped off, so if she comes back on, we'll let her go. And I also just want to acknowledge we're joined by Lisa George from Senator James Sanders' office. So with that being said, we will now turn it over to Dr. Ray to give a presentation. And I want to once again thank you for being here and for the important work you're doing around equity and access when it comes to this vaccine and education, most importantly. Because we got to make sure we get the facts out there. So thank you so much for being here. And you may start your presentation.
Oh, I think we got Alicia again, BP.
All right, 1 second. All right, now I'm going to my Assembly member and neighbor, Alicia Hyman, for some quick remarks, and then we're gonna come back to Dr. Ray.
Thank you, Borough President Richards. I love the office. It looks really good. So I just wanted to say that I'm so glad that you're doing this. People think that we're overdoing it with the information, testing, and vaccines. We're not. My oldest daughter is 22. She just came home and told me her best friend, who's also 22, and her best friend's boyfriend both came down with COVID. So for the young people that are out there thinking that, you're tired of hearing about it, now her friend is experiencing pain, body aches, no sense of smell, no taste. So this is just a reminder. Thank you so much for doing this. I know you have some expert information that you're going to share with all of us. And this does not discriminate age, income, race, religion. Please understand that this is serious. Thank you very much, Borough President Richards.
Thank you, Assembly Member. Thank you. All right, we now will go back to Dr. Ray.
Thank you, everyone, for having me. I'm coming to you as a proud Queens resident, just like everybody else on this call, and I'm really happy to share this information with you today. I'm going to give you a very, very quick update because I want to leave as much time as possible for questions and answers, and that means any question, like the way that we combat vaccine hesitancy. If you're unsure about the vaccine, if you have questions about it, the answer is conversations, right? And I am here to answer all of your questions. But let me just give you a brief overview really quickly. And again, thank you everyone for having me. Can you advance the slide, please? So I'm showing you something on the slide that everybody knows, right? And everybody knows that we in New York City have been really heavily impacted by COVID. What I want to draw your attention to is a couple of things. One is something that we talked about at the beginning. Everybody at the beginning has talked about this, but that that these colors across the city are not equal, right? There are hotspots in different areas, and there have been impacts that are different for every neighborhood. Now, you know, Queens is pretty dark here. Queens has a lot of the spots that are heavily impacted by COVID. If we talk about the whole city, we have a graph on the screen that's showing the daily number of new cases. And what we can see is March and April, which is a time, you know, nobody wants to return to and everybody will remember for the rest of their lives. This number that shows on the graph for March and April is an undercount because, as you'll remember, we didn't have a whole lot of testing then, right? So this only represents the people who are really sick. The actual number is probably way up higher. But you'll also notice that the curve goes down really quickly. It goes up really fast, but it also goes down really fast. And the way it went down really fast is that we all work together. We all work together as citizens of New York City, right? As communities, as neighbors. And we followed those core four that I thank you, Borough President, so much for mentioning, and everyone else who mentioned them. I'll remind you of what they are in a second, don't worry. But you know, we brought those numbers down, and we brought them down for a long time. And, you know, in a lot of ways, a second wave is inevitable, but we prevented it for so long, and we're keeping it under control to a point where our hospitals are not anywhere near in the bad position they were in March and April. But as you can see, this curve went back up again, right? And we are up at a high point again. And that's because as much as we try, you know, as much as we wear our masks, as much as we avoid mass gatherings, that's something that you have to do all the time and keep doing until you get to the next phase of the vaccine. And or the next phase of the pandemic. I gave away my hook here, but can you advance the slide, please? So you have to, you know, our armamentarium, right? I think of it as weapons, right? Against transmission of disease, weapons that can prevent illness and death. And those are what we have all been doing so far, but now is not the time to stop. We need to continue doing that. And so to stop the spread, every single person should get tested and separate from others immediately if you test positive. There are resources, and my colleagues can put some links in the chat. But there are resources if you have trouble isolating from others, but you can get tested and you can find a free test at nyc.gov/COVID test or call 212-COVID-19. And then follow those core four prevention strategies. People who know me are so sick of me talking about them, but you cannot talk about them enough, right? The only way you can talk about them enough is if you do them enough. And so the first one is stay home if you're sick. Right? Stay home if there's a chance that you could have COVID and transmit it to anybody else. So if you've tested positive, if you've done a high risk activity like traveling, if you've been in close contact with someone who has COVID-19, wear a face covering whenever you're outside your home, indoors, outdoors, it doesn't matter. Keep 6 feet of distance from anyone who's not in your household. And of course, excuse me, wash your hands or use hand sanitizer. That's not a COVID thing, that's an all the time thing. Keep avoiding travel and gatherings for now. And of course, if you or someone in your household is at risk of a bad outcome if they have COVID, you want to be extra careful. And we have a commissioner's advisory on that with a lot of detailed instructions. My colleagues can put that in the chat as well. And can you advance the slide, please? So I talked about, all of these things, this core 4, the avoiding mass gatherings, the working together as a community, that we have done constantly. We've spent the entire year doing that every single day, right? And there is something else. Are we going to have to do this every single day forever? Are we not going to see our family members if they're in the hospital? Are we not going to be able to celebrate our big gatherings? And this new phase of the pandemic tells us that there is hope on the horizon, right? And there is a lot of stuff on this slide, but the main point of the slide is to say that, this hope, right? Just the way that we always had to work as a community to stop COVID, to keep COVID under wraps, we have to work as a community with the vaccine, right? The New York City vaccine is for all. And for reasons I can talk about in the Q&A, we don't get to go back to a life that looks like the life before COVID unless the majority of people, unless almost everybody in New York City who can get the vaccine does get the vaccine. And so I will just say for a second here that vaccines are my favorite thing, right? I think vaccines in general are the best invention, the biggest accomplishment of humanity. And that's because a vaccine not only protects the person who gets it, but if you work together as a community, it protects the entire community. It adds up to more than every individual's protection. And so just that being said, New York City is really committed, and we've heard a lot from so many of our elected officials who are committed to equitable distribution. This means we had different colors and different spots on the map I showed you earlier, and we want to make sure all of those spots, especially the ones that are darker, especially the ones that are heavily impacted, can get this vaccine as soon as possible. So can you advance the slide, please? So what does as soon as possible mean? So as New York City, we are obligated by New York State's determination of who can get the vaccine when. And the reason New York State has chosen some groups over others is to maintain 2 things. Like I said, everybody's gonna get the vaccine. We want everybody to get the vaccine eventually, hopefully in the first half of this year. But the timing of it, who gets the vaccine first and who gets the vaccine later, can be done strategically, so you minimize the transmission of the virus, and so you minimize the number of hospitalizations and deaths. And so with that logic in mind, New York State has provided some guidance. I really encourage you to look at nyc.gov/COVID vaccine distribution, where we have a lot of detailed explanation of what the New York State guidance means for New Yorkers, for people living in New York. It's updated really frequently. I gave one of these talks in the afternoon once, and it had changed in the morning and I hadn't looked at it. So please check that site frequently. It's nyc.gov/COVID vaccine distribution. As many of you are aware, there are several groups that are at high risk of exposure, including, of course, healthcare workers, frontline workers in grocery stores for TLC, which was added recently, restaurant workers, and many others. Additionally, people who are at high risk of disease or at high risk of getting the disease, such as people 65 and older, and of course, residents and staff in nursing homes are both at high risk of disease and at high risk of a bad outcome if they do get the disease. Again, keep an eye on this. As New York State expands the eligibility, we are also expanding the eligibility the first second we can. Can you please advance the slide? So here's the big question. So when will the vaccine be available to everyone? As I said, it will be available to everyone The question is, how long will that take? We expect that it'll be mid-2021. The supply is limited. We're really at this point governed by the supply. I think that there was, as the vaccine comes, we are trying to distribute it as quickly as we can, and of course, as equitably as we can. Like I said, this is a community effort. And so for those who are not eligible, you are still getting some benefit from people at high risk getting the vaccine now, and you will get your vaccine. Again, we're committed as New York City to broad and equitable availability, and we are working as hard as we can with the supply we have to make that possible. Advance the slide, please. So this is a quick reminder that the vaccines that are available now, which is actually something that's a little different than the Johnson & Johnson vaccine mentioned earlier, but the vaccines that are available now require 2 doses to give a person full immunity. So the first dose, after the first dose, there's some side effects that are often limited. I've had my first dose. I felt pretty crummy, I'll tell you, the next day. I was feeling pretty bad. And then I woke up the next morning and I was completely fine. So, you may have side effects after that, but to get full immunity, right, you have to wait another 3 to 4 weeks to get your next shot. You can wait up to 6 weeks and perhaps even longer, and then wait another couple weeks after that for your body to really get the full, to fully be able to recognize the virus that causes COVID-19 and to protect you against it. I'm getting my second dose Sunday. I will come back afterward and let you know how it went. But I know lots of people who've gotten their second dose and they're doing great. There a lot of healthcare providers I know are really happy that they were able to get 2 doses of the vaccine, and they're all doing fine. So like we said, I think there's a lot of worry about timing. The supply of the vaccine is improving every day. We have a lot of plans to improve it, and it'll just take some time for those plans to go into effect. But in case you can't get the second dose exactly at the date, right, exactly before 42 days, do still get that second dose unless your healthcare provider tells you not to. Because the vaccine, even if you've taken it a long time later, will be more effective after the second dose. If you have gotten your first dose, make sure you get an appointment for the second dose, and make sure that that appointment is at the same location where you received the first dose. That is something that comes down to us from New York State and that we don't really have a lot of wiggle room on. And can you advance the slide, please? So how do you make an appointment? I think that we have talked about the website. So nyc.gov/COVID vaccine distribution, nyc.gov/COVID vaccine distribution gives you information on eligibility. If you are eligible, you can go to vaccinefinder.nyc.gov, or you can call 877-VAX4-NYC, and my colleagues will also put that in the chat. I know that people have had a lot of difficulty with the website. It was complicated. We heard that. We tried to streamline it. There are some questions, and if you ask me, I'll tell you right now what those questions are that we have to ask everybody to, that is determined by New York State in terms of eligibility and in terms of the trials that were conducted on the vaccines. But I'm happy to tell you those ahead of time so you know what you're getting into. I think a bunch of you were also frustrated that there were not a lot of appointments, or it was hard to make an appointment. At the moment, until our supply is better, we are only opening up appointments a week at a time. And so don't be discouraged. And if you don't have an appointment, you don't have to follow it every second of every day. I think on Vaccine Finder, you can sign up for a notification, and they will give you a notification when more appointments are opening up. I just booked appointments for my parents, and so I really understand the frustration. I mean, I had my whole family across the country just sitting there on the computer refreshing the page. And of course, there are many locations where you can get vaccinations. And we talked about CVS. There are also community and hospital clinics, and of course, the vaccine hubs that are run by DOHMH and our partners at Health and Hospitals Test and Trace. And of course, you can look at our Vaccine Command Center, which involves agencies all around the city, nyc.gov/VCC for regular updates. And can you advance the slide, please? So I'm not going to read everything on this slide so we can get to your questions, but you know, what can you do? So first of all, I'm going to say, if you're eligible for your vaccine, get your vaccine. Before you get your vaccine, after you get your vaccine, and like I said, everybody will be eligible for the vaccine. But before, after, while you're in the middle of your vaccine, keep strong with those core 4 prevention strategies, right? The stay home if you're sick, wear a face covering, maintain that physical distance, and wash your hands. And then the other thing that we can do is, as you learn more, as you have conversations, as you hear information about the vaccine from trusted sources, like the health department, like DOHMH, share that, right? Look at the COVID vaccine site frequently, read our fact sheet, share the flyer, and share, and everything you know, share your experiences on social media. And I think that's all I have for my presentation. So thank you so much.
Thank you so much, Dr. Rand. We're going to go to questions now. So I'll start with why is it so hard to get COVID vaccine in Queens? Why can't we get City Field? Is Queens only? Forest Hills has no free sites or is under monitored? All right. So we could touch on that. Now, one, I want to thank my staff, and I know this is something that we noticed, and we've been trying to resolve this issue around the gaps with testing, and we work with Karen. And we also got testing at Borough Hall. I mean, we had testing sites, testing at Borough Hall. We had hundreds of people get tested here. So we're going to look to bring that mobile unit back soon. And then also, you know, there are gaps, still a lot of gaps, and we're working with both the mayor and the governor on vaccination sites, period, across Queens. Think about Eastern Queens, who has no vaccination sites. Think about Central. Bob Holden spoke of his area that does not have testing. So what we've been trying to do is supplement a lot of the places that don't have testing currently with the mobile units with the Health and Hospitals Corporation. And I will say that they're very popular and they're stretched thin on this. So we're like pulling in every corner to make sure everybody has testing. And I'll let Karen respond if she wants to, and then we'll just go to H&H on the need for more testing still in vaccination sites in some of the places that don't have, and what are you thinking about the expansion on City Field? Obviously, I wasn't happy to see Yankee Stadium open up first, but I do anticipate we'll get some news on Mets Stadium soon. And we know the Mets were hit a home run very early, even before the Yankees, on this issue, opening up their stadium. So we anticipate we'll have some news on that, especially since the Biden administration is sending more dosages into the state. So I'll go to Karen.
Well, I just want to say that just this week, because Forest Hills does not have a place where people can go and get the vaccination, I myself, before Thanksgiving, I went to get tested and I paid $195 to get tested because there was no place that I can go for free. I went to the Northwell on Queens Boulevard and paid the $195 because I wanted to be tested. Forest Hill Stadium called me just this past week and offered for us to use their facilities, which would be great. I was in touch with the city. I had told, the mayor's office, and also I have reached out to the governor to tell him that Forest Hill Stadium has offered their site for the testing, for the vaccinations, and hopefully we'll hear from them very soon.
Thank you, Karen. And if you drive, or if it's easy and this is an accessible location, I would also recommend the Kew Gardens Hills Library, which has really been a place that we go, which is literally like as well 10 minutes from Borough Hall, and you can actually get rapid testing there. So if you can make it there, it's a great, they're very professional there, and I've been there twice just to make sure everything is safe and sound. But that's a location you can get to as well. But we're gonna also bring the mobile unit back to Borough Hall eventually as well. So really take advantage when we put this information out. This is for the health department. I've been trying to make an appointment for getting a vaccine in Queens for weeks and everything is full. Are we getting more vaccines and more locations for vaccines?
So I think at the moment, you know, like I said, we are really dependent on the supply that we get from the federal government and which goes through the state, right? So we have very, very little control on how much vaccine we have and when we get it. Now, I can say that at least in the sites that we have now, we are getting the vaccine out as soon as we can, right? We're getting that vaccine out fast, vaccinating thousands of people a day. And we want to continue that and open up more appointments as soon as we can. I think also, I mean, if the vaccine supply becomes stable, we can open up appointments further in the future so that, so that it's easier, it's more convenient to arrange times. But at the moment, we just don't have the ability to do that because it will result, if there's any instability, in canceled appointments. And, we really don't, we know how much work it takes. We know how much work it takes to get there. We know how hard people are trying to get to the vaccine hubs, and we don't want to have to cancel appointments. I do want to just mention that I think my colleagues can put the link in the chat, but there is, for seniors, there is transportation assistance to get to your vaccination site. And it's, this is something that was very, very important to us from the beginning. Also, I want to just mention that there is a phone number to call, that 877-VAX for New York City. I know I talked about it in the presentation, but I want to bring it up again. I know that not everybody is comfortable using websites to book appointments.
Thank you. All right, this other question was very similar in scope, mothers over 65 and been on the wait list. So once again, we all are pushing and want the federal government to send more vaccines in, and obviously under the prior administration, presidential administration, they did not even order up vaccines. So the Biden administration has come in and done some executive orders and certainly has moved some more vaccines increasingly into the states. So we're continuing to lobby for that. I have a vitamin B12 deficiency and I do self-injection of vitamin B12. Will my taking the vaccine be a problem?
It shouldn't be a problem at all. So there are very, very few reasons not to get the vaccine. I think that if you have a healthcare provider, it's always great to talk to your healthcare provider before, but there is actually a specific list of questions that you will be asked when you try to sign up for a vaccine, which are situations where you should talk to your healthcare provider before you get it. Those are situations like if you're on drugs that suppress your immune system or your immune system is suppressed another way, because that means that the vaccine, your body's immune response may not be as strong as it is otherwise, or as strong as it is if you didn't have that condition. I think for pregnancy and breastfeeding, that's something where we always want to be careful with people who are pregnant, with people who are breastfeeding. And so that's a situation where, again, you can still get the vaccine, but it's always a great idea to talk to your healthcare provider before. There are a few other conditions with medications where we might not recommend, or where we might ask you to talk to your healthcare provider first. Vitamin B12 and injections actually will likely be at a different site. So vitamin B12 injections are actually too big to give in your arm. This injection is very, very small. It's 0.5 milliliter. I can tell you, I don't remember how many people I've vaccinated at this point. I actually set up the Hillcrest site you were talking about. But often, almost all the time, if they're not looking, people don't even know that the needle went in. And so this is going to be different than your B12 shot, which is a little bit of a bigger needle. It might be a little bit more of an ordeal. This is much, much simpler than that.
Councilmember Holden had a question or comment.
Thank you, Borough President. Doctor, thank you for that great presentation. I wish if we can get a copy of that, that'd be great to run it on our social media if we can. But I have a question about what you said before, that the state of New York requires you get the second dose at the same location where you got the first. Why is that?
So I imagine it's because in terms of logistics and supply, it is much easier if you can anticipate where all your second doses are going to be. So, you know, if I know that 100 people got doses at, you know, site A, then several weeks later, I know to give 100 doses. I know to save 100 doses for site A, and then I know to give it to them later. Now, I mean, that's not done everywhere. And you know, what you save in the logistics, you know, does create more inconvenience for people, and it does create, it does make it more difficult. I can't comment.
Can I just jump in for a second? Because the second part of the question is, some people got, in my neighborhood, 65 and over, got their vaccines at a small pharmacy, and the pharmacy said to them, we don't know when we're going to get more, because they're not really telling us. We only got 100. So the people that got the first 100, do they actually reserve the second vaccine in the same pharmacy, or are the pharmacies, you know, asking the state when we're going to get the next vaccine? So then people might be left high and dry.
So at the moment, and I know there's been conversation around this, but at the moment, especially given the tight supply all over the country and honestly all over the world, those second doses are held in reserve and are shipped out at the appropriate time. And that's why I was talking about the logistics for the people who are supplying the vaccine are much, much simpler if you can do that, right? But again, I mean, I can't comment on which way is better, but I can tell you that, you know, it's always a trade-off between convenience to the person getting the vaccine and versus the ability to manage the logistics for thousands of people.
Thank you.
Thank you. My parents are in their 80s. They live in Astoria. What is the website to make an appointment? And for my staff in the chat, she left an email as well. If you can email her as well, that would be helpful. But if you want to give that, Doctor.
Sure. It's vaccinefinder.nyc.gov. And again, if you're uncomfortable making that appointment on the website, you can always call 877-VAX4-NYC. And then I think I got that right. Now I've said it so many times. It's like if you're trying to explain to someone how you're tying your shoes, right? 877-VAX4-NYC.
Let me just double check. So this question is related to, let me see. I don't know if this is going to be, and I have to confirm this, but you can get in touch with the office. But I believe the governor's office, this question is, when is the vaccine coming to Flushing Meadows, Corona Park? I believe the governor's office, and I'm waiting for final confirmation, is looking to do a vaccine pop-up, I believe in Corona this weekend, possibly. So once we have that information, we'll avail it to you. So just stay in touch with the office. That's possibly Saturday. Okay, what are you doing to address elderly residents being able to sign up for testing and making sign up more ADA compliant? I guess that's for the health department.
So, and I have to double check this, but I think there were some issues with the website, but the website should now be compliant with this guidance called WCAG 2. So the ADA compliance for websites is something called WCAG, and it's in its second variation. And all of the city's websites have to be compliant with those standards. If it is, and I haven't checked because I'm not on the web development team, but if it isn't, it will be soon. And if there is a problem with the website, like I said, please call the hotline.
All right, okay, great. This is a question: should an 80-plus-year-old senior with a heart murmur get the vaccine?
So this is a great question. I get variations on this question all the time. And the way that I like to think about it is that just by walking around New York City, and I think we heard mention of young people who get the virus, but everybody at every age, just by going around New York City, is at risk of getting COVID. And the risk from COVID is so tremendous, right? So when you're thinking about potential risks of the vaccine, you want to weigh them against the risk of COVID. And for me, in my opinion, the risks are, I don't want to just say in my opinion. So with my knowledge as a physician, as someone who's worked in public health for a long time, the risk of COVID is so much greater than the risks associated with the vaccine. So the vaccine, we talked about side effects, which are normal, right? Feeling crummy is normal. When you get sick, you feel crummy. And most of that is your immune system learning how to fight whatever it is that's making you sick. And so if you feel crummy, it actually means that it's working. Your body is learning this, this virus. In terms of serious side effects, there have been a small number of severe allergic reactions, and this is extremely, extremely small. It's one in, I think, hundreds of thousands. And that, I like to compare this to peanut allergies. So if I've never eaten a peanut before, right? I've never seen a peanut before, I've never been exposed to it. And all of a sudden, I start eating peanut butter and jelly sandwiches. It's possible that I will have a severe allergic reaction to that peanut butter and jelly sandwich. But we don't stop people from, we don't take the peanut butter and jelly sandwiches off the shelves. And for most people, for the vast majority of people, it's okay to eat that peanut butter and jelly sandwich. Now, in the extremely rare, and I'm going to jinx myself, but I haven't seen one of these cases yet, and I've overseen the vaccination of thousands of people. But in the extremely rare case that something happens, we do observe you after getting the vaccine. There are physicians with emergency medicine, every clinical person and every non-clinical person, and many of the non-clinical people are trained on how to manage a severe allergic shock. And then most of the sites also have emergency medical personnel there in that very worst case scenario.
Thank you for that. All right, what vaccine centers are available for Black and elderly communities? And this gets back to the conversations we were having. And I will say that, we've had a few. I think there was a pop-up site in St. Albans last week, and I think they vaccinated over 200 or 300 people. I think we were at International Towers, which is a public housing development. And they vaccinated close to 60 or 70, close to 100 people there. So there have been pop-ups, but the problem is, once again, and I don't want to keep getting redundant on this, was the access to the vaccine coming into the city and state. And obviously everybody's getting vaccinated. A lot of people were, and there was a shortage. So we're starting to see the vaccine come in. When do we know when the city will set up vaccination sites in convenient locations for seniors, like senior centers, senior housing, local churches? I believe the Biden administration actually signed an executive order on this, going back to, I think, the day after he got elected. But this is one of the things all of my colleagues and I have stressed, is the importance of making sure that we're using community-based organizations, houses of worship. And if any of my colleagues who want to hop in on this, they're more than welcome to. But this has been something we've been stressing, because we know that you will trust your senior center and your community-based organization more, and your local house of worship more than, sometimes the government coming in and setting up shop in your neighborhood. So we know cultural competency, language access, all of these things are very important in order for us to really get the public to buy in and gain confidence in taking this vaccine. So that's to be continued. But once again, as we ramp up, we anticipate, and we've heard the language sort of change a little bit from the administration over the last few days about the importance of making sure that these locations are centered in communities, and that you don't necessarily have to travel to Met Stadium, although Met Stadium's a nice place. But it's hard. If you live in Eastern Queens, how do you get there by public transportation? If you live in Southeast Queens, you're talking about 2 hours, 2 hours and a half. If you live in Forest Hills, you still would have to travel. We don't want you to have to travel out of your neighborhood, but that all comes with the need to ensure that the vaccine is available. All righty. I'm just scrolling through because I don't want to be redundant. I had a question on the transportation, Dr. Ray, if you want to just go through that again and how that's working. I think somebody put in the transportation options are not working well. So if you could just speak to that and who they can call, and what are the criterias for a free ride?
I actually, I don't know the exact criteria around the free rides, but I do know that when you call the hotline and through the information that was placed in the chat that you can request it if you're eligible. And I'm sorry about that, but we can get back to you with that information.
Great. If you contact Brennan, our office, we can get you that information. All right, we're supposed to end at 7, so I'm gonna get to a few more. My mom is 70. She got the shingles second booster vaccine 28 days ago. Can she get the COVID vaccine now?
Yes. So we ask that you wait 2 weeks between any different vaccines. And that's really because the effects of the vaccines, you want to know which effect is going with which vaccine. And that's especially important with the COVID vaccines because there are, I think it's a list of like 10 different agencies and independent organizations that are keeping an extremely close eye on every side effect, everything that happens, even in proximity to the vaccine. I think they had to record, there was a patient who got the vaccine and was subsequently struck by lightning, and they have to record that in the registry and investigate if the COVID vaccine had anything to do with it. I also wanted to mention just about the accessibility. Just all of our sites, all of the New York City vaccine hubs are ADA compliant. And so there is, we will make sure that you get in to get your vaccine. Please don't worry about accessibility if you come to the site.
BP, I heard of Forest Hill Stadium offered a place. We also have Resorts World Casino. Why not use them? Resorts World Casino, actually, you can get vaccinated there. So that is open. I believe it's still open. I was there with the Lieutenant Governor just last week. So you have to make your appointment. But Resorts World is a site. All righty. Can you speak to getting your second dose? So somebody raised, they got their first dose at one location, and I actually was with the mayor a few weeks ago, and he was stressing this to the health department commissioner at Hillcrest. When people sign up to get their first dose, they should be given an appointment right away while they're there. And I do also want to commend the health department because they do have waiting rooms as well. And we got to speak to a lot of individuals who took the vaccine in those waiting rooms who were being monitored. And I can tell you that it was nothing but positivity coming from everyone in there. So can you just speak to getting your second appointment while you're there? Did that change happen, or do you have to go home and then schedule a second appointment?
No, I think at the very beginning, I think it just points to the fact that we are standing these up, and this is something that has not happened in the U.S. for 100 years, right? Something of this proportion, and so we're still learning. And so we didn't, we were on the first couple days at Hillcrest, we didn't do that, right? We didn't sign people up for their second appointments, and we soon realized, or we didn't sign everyone up for their second appointments. We did sign some people up who had trouble booking it themselves. But then we realized that wasn't great. And then several of our sites actually just started doing it because people realized, the people on the ground realized we need to be doing this. And now it is policy. Now they're actually, if you go to the vaccine hubs, you'll see desks and teams there who are dedicated to signing people up for their appointments. And I think that the other thing is, they might actually, that they're going to make sure actually that you don't leave without getting your second appointment. If you do have, if there was an issue, if you have trouble, you finding the email you get after your first appointment, the website has actually changed. It used to need confirmation of your first appointment to let you book the second. If you're not in our registry for whatever reason, you can still book your second appointment.
And once again, I think I've seen this twice, just making sure that criteria for transportation is put in on the website, so I think that's something that I've seen twice here. Zip codes, and we've heard this, people coming from New Jersey and getting the vaccine in New York City. So I think that's being addressed now. And also prioritization by zip codes, I think, is something that the administration is shifting to as well. Is it-
Sorry, I just wanted to make the quick point that, when we say everybody in New York City has to be vaccinated, that includes both people who live in New York City and people who work in New York City. Because if somebody's spending their entire day in New York City or half of, their 24 hours here, that virus can still be transmitted. The virus doesn't care what state you're in.
This is one thing we didn't, the number one question we should have asked is who's eligible right now?
Yes.
We didn't even ask that question.
Excellent.
Who's eligible?
Yeah. So there's a long list of people who are eligible, and I think we shared in the chat already, but maybe we can put it in again, the website for eligibility. It's nyc.gov/COVID vaccine distribution. But so people 65 or older, so all people 65 or older who live or work in New York City. And if you are 65 or older, I can tell you, we were not expecting the large number of people who don't live and work in New York City. I mean, I think it's because we had vaccine and we were distributing it efficiently. And so people were coming from outside of New York City, but, our operations are for New Yorkers first. And so you will be asked to prove, to show something that proves your age and something that proves the fact that you live or work in New York City. And then I think for everybody else is really different people who are who could be exposed to COVID or at high risk of being exposed to COVID by nature of their work. So I think healthcare workers have been eligible for a long time. People who work in grocery stores, for example. I mean, everybody goes to the grocery store, right? Everybody has to make some contact with the grocery store. Some, home care workers. I think it's a long list and you can check it out, but we recently added taxi and limousine drivers and everybody who works in restaurants.
Great. If someone was exposed to COVID-19, should they still get their vaccine?
It's a great question. So if you have COVID, if you are supposed to be quarantining, or if you get sick, if you're supposed to be isolating, right? And I can go over the guidelines for that. But if there's any risk that you could give anybody else COVID, we don't want you to come to the site because there's going to be a lot of high risk people there. We want you to wait until the appropriate time. So if you have COVID, we want you to wait 2 weeks. So that's if you have a test, or if you are exposed and you start developing symptoms, we want you to wait that full 14 days. Or if you have, if toward the end of the 14 days, if there's some time that's passed and you haven't gotten better, we want you to wait for 14 days from when you've gotten better to really go out anywhere as much as possible. Now, if you've been exposed to someone with COVID-19, now you will likely get a call from our contact tracing team. And at that point, and really once you're exposed, so from the date that you were exposed, if you don't have any symptoms, then you can wait 10 days. And if you still don't have any symptoms, you can just check for symptoms, but you can go out after day 10. Now, a lot of people are worried that having antibodies to COVID or having COVID recently will interfere with the COVID vaccine, and they won't. It's almost like a booster dose of the vaccine. And so while you may have more of those side effects, you may feel a little crummier after you get the first shot. I had COVID and I felt kind of crummy after I got the first shot. You may feel a little crummier, but those symptoms should go away within 1 to 2 days. And I can tell you in my experience, I went to bed and I was like, oh no, I'm not gonna be able to go to work in the morning. I called them, I said, because I'm used to, if I feel that bad, that I'm gonna feel that bad for a long time. Went to bed early, woke up in the morning and worked a 14-hour shift. So no problems at all.
Can people, so the only way to book an appointment is online, or can you call 311 and book an appointment?
I'm not sure about 311. I'm not sure if 311 can connect you to the other hotline.
Okay.
I think it could at one point. I don't remember if that is the case right now, but we do recommend you call that 877 VAX.
That number? What is the number?
877 VAX, VAX for NYC. And they will put the number in the chat with the actual numbers on it.
What is the difference between Pfizer, Moderna, and Johnson & Johnson vaccine?
Oh, you got the sciencey question. This is my favorite.
It's a good one. Well, one I know you only have to take one shot. I think I'm right. I'll let you give it though.
Okay, so the Moderna and the Pfizer vaccines are what we call an mRNA vaccine. And those are the only two that are currently available in the United States. So if you get a vaccine in the next several weeks, probably, that it will be one of these mRNA vaccines. And an mRNA vaccine is a really great invention. What it does is it takes a little blueprint, kind of a disposable blueprint for a particular protein of the virus. It goes into your cells, your body, your own system makes just that protein. It doesn't make any virus, it makes just that protein. And your body learns that protein. And so when your body sees the virus, it'll say, hey, I recognize that protein. This is something I have to fight against. And the really interesting thing about this vaccine is that it just, you know, there's nothing left of it. It's gone from your system really, really quickly. Your mRNA, it's genetic material, right? And most of you have heard of DNA. And you can think of DNA as like a big, heavy book, right? That tells that when you read the DNA, it tells you how to make an entire organism, right? But the DNA is pretty precious. It's like one of those old books or one of those big books in the reference library. So lots of people want to read it, but you don't let each of them take out the book. What you do is you have them copy a page of the book or take some notes from the book and then take those notes, use them for whatever they need, and then throw them out. And the mRNA is exactly the same. It's a copy of a little part of the virus's genome, just a little part of it, not the whole thing, can't make a whole virus out of it, can only make this protein. And then after the body has read it and made a protein out of it, it disappears, it dissolves, it goes away. So the Johnson & Johnson vaccine is a little bit different. And instead of just being this mRNA, they actually hide the same sequence, the same way to teach your body how to make that one protein. They hide it in a totally harmless virus. So again, there's no SARS-CoV-2. There's no virus that causes COVID-19 in it. You've only taken the piece that's a protein, but you've hidden it in a totally innocuous virus. And then that virus sort of gives the blueprint to your cell, and then the same way your cell makes the virus. Now, practically, there are a couple differences. So for the mRNA vaccine, you need 2 doses. So you need to have, and you know, there's still data coming out on this, but you need to have, you're not immune until a couple weeks after your 2nd dose. Pfizer, it's 1 dose, 3 weeks, then the 2 weeks of waiting. For Moderna, it's 1 dose, 4 weeks, and then the 2 weeks of waiting. Now the Johnson & Johnson vaccine, the data shows that you are immune after a couple weeks after the 1st dose. And so immunity happens faster. The other differences practically between them are that the mRNA vaccines are a little hard to transport. They're a little hard to store, a little hard to transport. It just means it's harder for somebody to, you know, it's harder for them to get from the factory to your arm. The Johnson & Johnson is much easier.
Great information tonight. All righty, we're going to begin to wrap up. I saw a question about New Jerusalem. I mean, I don't know how to answer that. I mean, you would have to give more detail on what information do you want New Jerusalem to get? And we certainly know your pastor, so you know we could get in touch with him if there's a need for more information. But I think we're going to begin to wrap up. I'm just scrolling through to make sure we got as much. Can our elected officials push for public safety volunteers and food pantry volunteers to be put on the list? I mean, it's a great idea, but once again, there's so many people trying to get lined up. And I think the state, and I think you could answer this, Dr. Ray, the state sets the criteria.
Mm-hmm. Yeah, we can ask the state. And I believe, I don't know exactly because you know, the mayor doesn't tell me what he talks about with the governor, but I think that, I think there are conversations about it, but, you know, we all we can do is bring it up. We don't have any control over whether food pantry workers are allowed.
Right. Well, thank you so much. Thank you all for being in attendance this evening. And I hope you got some information on tonight. And as Dr. Ray said, she got the vaccine. Once again, I met a 92-year-old young lady at Hillcrest High School who who took the vaccine and felt fine. So I really urge everybody, and I think that's one of the reasons we want to continue to do these town halls. We're going to have a series of these geographically to ensure that this information is getting out across the borough. But when you're able to take the vaccine, I urge you not to wait, because eventually what's going to happen is everybody's going to have access. I'm going to speak it into existence. And you're going to have a rush and you're going to really be waiting for a long time. So I really stress everybody who's eligible to not second guess this, to go out and take the vaccination. I was at Elmhurst Hospital. I got to witness, 2 individuals get it, the healthcare heroes there. We saw LIJ was where the first place where this vaccine was administered in the country, and that healthcare worker's okay. So I really urge us to all get out there and take the vaccine and not to, adhere to all the rumors that we hear out there. Stick to the science, listen to those who are doing this day in and day out. And once again, I don't discount the history we've had in this country when it comes to vaccination, but we need to, this is safe. The other thing, just ending on this note, is we are pushing for vaccination sites in every corner of the borough. I can tell you that now, every single corner. Once again, I want you to be able to leave outside your door and have access to a vaccine and not have to travel. So that is the end goal. And the end goal is to ensure we're using many of the organizations in places that we know in our communities as staging locations. You should actually, once we get back to some semblance of normalcy, it would be great to even be able to go to your community board meeting and get your shot there. I mean, that's really where our mindset is headed as we talk about ensuring everybody has access to the vaccine. So with that being said, I want to thank everybody for joining us tonight. I want to thank all of my colleagues who joined us, who've all been advocating strongly. No one has been shy. Let me just say that, about the need to make sure that their corners of the borough have access to the vaccine. So with that being said, I want to thank you all for coming out tonight. I want to thank my staff, in particular, Carolina, Tiffany Easton, Brent, and Chris, for their work in putting this together, and all my other staff. And we look forward to continuing this series as we move to make sure that this is more accessible in Queens. So thank you all for being here. Hope you got some good information. Enjoy your evening. We'll see you the next time.
Thank you.
Thank you. Thank you.